Nutt. I'm the elderly benefits specialist for Burnett County, and I'm really concerned about the senior care program, the homestead tax credit, and the Badger Care program, and the cuts that are going on there. And I know there was a great big surplus in the senior care program between 20 and 24 million. We have over 96,000 people on that program in Wisconsin. I know most of the people are going to wind up paying out thousands more in premiums, deductibles, and co-pays if they have to go on Medicare Part D. Do you think Herb Kohl's letter is going to help when the federal government approved the senior care program and put some money in? Do you think that letter is going to help and get anywhere to help keep the program as it is, to override Walker's budget?
Go ahead. Well, I just want to mention one thing. That program was so successful, and actually last year had that $24 million surplus. And what the governor did with that $24 million surplus was put it into the budget repair bill to fund the tax loophole for people that are less than 2% of Wisconsinites that utilize these health savings accounts that got this tax break. So it was used to help balance his budget to give these tax breaks to essentially people who really didn't need it.
Right.
When that money could have been used for seniors.
And I know they're doing a lot of talking, like they think a lot of people will be eligible for the low-income subsidy on Medicare Part D. And I know that's not the fact. A lot of people that are on the senior care program have a little bit more in assets, so they're not going to qualify for that LIS program. Or they have a little bit more in income, and it's going to hurt them so bad. And the same way with the cuts to the homestead tax program. I have a lot of people that lose their homes and have a heck of a time paying their taxes the way it is. And it just scares the heck out of me. What's going to happen to these people?
Well, yeah, it is. It's almost sinful when you see them pass this health savings account tax break to somebody who's making $5 million a year, and then have a Park Falls resident tell me that he got this letter that said, your benefits are about to expire. And he said, I have a heart condition, and frankly, I thought I was going to have a heart attack. I don't understand what kind of callous mentality you have to reach this point. This individual is willing to pay more copay, more on whether it's 30 or you go to 40. Everybody's willing to pay a little bit more, but basically, this plan is trying to undo senior care.
Oh, I know.
We don't know how many citizens are going to be protected with the wraparound yet.
Very few.
But we know this, that every one of them are scared to death they're going to lose the most important program they have.
Yep.
And number two, it's a response to your question on Herb Kohl's letter. It'll be very helpful because the federal government has to approve our plan. But in that budget despair bill, not budget repair bill, there is a provision that most of you are aware of that gave the Secretary of Health Services the authority to cut Medicaid services even though the law says they have to get them. So if this Secretary of Health Services decides that he doesn't want to pay for dental care for adults or wants to limit it, he can. It goes to the standing committees and they can look at it, but there's not going to be changes. So he has the ability to do that even though the law says adult care, dental services should be provided. That proposal also says that if the federal government does not accept the state's plan, they're going to remove 55,000 people from Badger Care. Let me say that again. They're using 55,000 of our most vulnerable citizens as hostages in their effort to say, if you don't like what we're going to propose, they're going to suffer. I understand. You have to be heartless to include that, and it's dereliction of duty for a legislator to give that kind of authority. They held me, they said I was in contempt because I left Wisconsin. I did more to defend Wisconsin from the land of Lincoln than they did in their dereliction of duty to sell out the people of Wisconsin. And when people hear that, they then become even angrier. Again, that's not shared sacrifice. That's sacrificial lambs.
Well, I think a lot of people, too, think the Badger Care program is a free program, and to a lot of people, it's not a free program. Most of the employers in this area don't employ people full-time. They don't have health insurance benefits for their people.
That's right.
And if they're low-income people, and if it wasn't for the Badger Care program, a lot of them pay premiums to have their medical assistance-type health care. They pay premiums for that, and a lot of people don't realize that. They think it's free. People are just on the dole, they're taking all they can get. They don't realize all these things that are out there and how many people are paying premiums to try and have some health coverage for their families. And what's going to happen to them if that coverage is not there?
Well,
They're going to wind up in the emergency rooms, which is going to cost all of us more money. It's just, I don't know, totally non-thinking.
Well, and consider the fact that Medicare Part D was written by and intended to benefit the insurance companies and the prescription drug companies, who under senior care pay a rebate. Saves the state of Wisconsin $79 million per year in drug costs. That, we know that a good portion of those drug costs are now simply going to be paid by the customers, and they become increased profits. We don't know whether the number is $100 million or $200 million, but it is a lot of $1 million that is going to leave Wisconsin and is going to feed the pockets of those directors who care less about the people who live in Wisconsin. That's not shared sacrifice, that's sacrificial lambs. And it isn't what Wisconsin citizens expected. It is neither big government or bad government. Small government is cruel government. And frankly, people, the more they hear about it, the more frustrated they are. This budget process is designed for the public to speak, and then the Finance Committee will begin to review, literally, agency by agency, line by line, and you can be assured that the 4 Democrats in that committee are going to make every effort to restore this program back to as close to intact as possible. There may be more copay, there may be some increased responsibility, but I don't think we should abandon people. Yes?
We hear a lot in the news about the Republicans are doing this, and the Democrats are doing this. So you talk about the state to try to stop things and get it out. I think get everything out in the open a little bit, give some time. And they found a way to wiggle around that. But it's like Democrats, Republicans. Are there any Republicans that have an ounce of sense? Because, I mean, they are representing us. That's how they got there.
Let me say that those of you who have heard me in the last forum or a number of forums, I don't turn this into a them versus our thing. Try to stick to what the facts are. One of the facts is that you have a Republican governor and a Republican legislature. That's a reality, and there are Democratic alternatives. The public wants us to work together.